Good afternoon. Welcome and thanks for joining us for today's HIS Talk webinar, How to Create Healthcare Apps That Get Used and Maybe Even Loved. It's brought to you by MedData. I'm Lori from HIS Talk and I'll be moderating. Our speaker today is Jeff Harper. Jeff is the founder and CEO of Duet Health, a MedData company. And with that, I'll turn it over to you, Jeff.
Great. Thank you so much. Certainly a pleasure to talk to everybody today. Duet Health has been doing this for some time now, so we're anxious just to share our experiences and to hopefully from this discussion help you overcome obstacles that we hear on a regular basis and give you the tools that you need so you can go out and build successful healthcare applications. When we're talking about applications and mobile technology, we're often talking about innovation, so it's really an exciting time. And we always think mobile apps hold a unique promise. We're often delivering new experiences, new things, something that someone hadn't been able to do previously. And it's an exciting opportunity that you can deliver. We only have an hour for this conversation, so clearly there's a lot of different topics we could talk about that are much longer than that. We're going to focus today on the user, and really it feeds back to the topic of this presentation. Really, to love apps and to use apps on a regular basis, the user has to be satisfied. And what we often see in healthcare is, a mistake or kind of missing a boat on helping to meet those user needs and expectations. And so we want to talk about value and how you serve your users in a great way. So I have a tendency to talk fast, so we're going to get started here in a second, but I'll try to slow down at every slide and make sure that we cover some of the topics so that you can take notes, or if you're just looking for other questions at the end, we can hit those with you. So let's just jump right into this. There's never been a busier time in healthcare. You can look at all the various buzzwords on this slide. They're all massive initiatives. And so we're talking about billion-dollar problems that need solutions and really something of a chaos, right? All of these things that are happening create tons of opportunity for us, but are creating lots and lots of work on the end of our healthcare partners and are creating a lot of new things that need to happen. And with all these new regulatory expectations, with all the new challenges being placed before them, it's really making it difficult for them just to do their job on a regular basis. You just need to be cognizant of this environment. We're often trying to hitch a ride on some of these and tie our deliveries. You'll be tying your mobile applications to some of the words on this page and helping your partners and clients succeed through doing these things. The challenge with that is, you have to be careful. You have to be aware and really proceed with caution. It's important to note there's more than 165,000 healthcare applications that are out there and available for users today. That was actually published, earlier this summer. So you have lots and lots of different things going on. You're not the only thing they're thinking about, and you can get excited. And no matter how exciting the opportunity is, you have to be aware of a number of big picture things that are happening. There's burnout in physicians. There's pressure from all angles to deliver products. There are lots of new initiatives they need to meet. So when you're delivering something, you shouldn't expect a warm reception. Don't just walk in and expect for someone to understand your value. You're going to have to be ready to sell it. You're going to have to be ready to present it. And you're going to have to be ready to understand how you're going to cut through all the various things that this user, this audience is going to see, because there's lots of things that they need to do every day to be successful to do their job. You're just one of those in the mix. So when we think of building a product, and really we'll think of this in two steps here today. One is planning and the other is execution. When you're planning, you clearly want to know the user. So you want to know who you're serving. You want to know why you're serving them. And you really need to know what their workflow is and how your product is going to fit into their workflow. And we've got lots of different representations on this slide. Patients, providers. Providers take different shapes and sizes. Nurses, physicians, other care team members that are part of the equation now. You have various business people and administrators. In healthcare, you have so many different audiences and contexts. Each has its own needs, each has its own goals, each has its own problems. And so as you're thinking about creating a solution, you're thinking about what your delivery is, you need to make sure that you understand that user. And importantly, you need to focus on what's in it for me. So you need to be focusing on what the value is they're going to get out of it. And the real challenge is you can have your own ideas for value, but the user has to see that value. And they have to feel that value in what they're doing. Kind of a unique part of healthcare is often the person paying or the group paying for the solution isn't the one getting it. So a pretty typical model is that a health system will purchase a mobile application program and then provide it to their patients. Well, that health system has different goals than the patients do. And so as you're going about building your program, you need to be working those two angles in parallel. You need to make sure that your patient users in that case understand what your value is. And you've got to make sure that while you're trying to satisfy the health system and their values, you're not moving too far away from that user and what they're doing. One of the unique aspects of healthcare is that users don't have to use the applications. So patients don't have to use this. They can find other ways to get the information. And that really exists in all different types of contexts. So this user value is often skipped in healthcare or missed. And it's because people are busy. It's not a reason for it, but that has to be front and center of your program, and you have to make sure that it's part of it. We really just wanted to hit two specific user groups here today and show you kind of a little bit about why those values are a part of this. And so first group being patients. And patients are really, even today, the largest percentage of applications that are coming online today. So out of the 165,000 applications I mentioned to you, the vast majority of those are geared toward patients. And so, as we think about a patient, what they're doing, they need simple and effective, right? I mean, it kind of goes without saying with their mobile application, but we see a lot of programs that are complicated or require some kind of education to use the product, or also require something for the patient to understand the value in it. Patients are going to wait. They're not going to wait. They're not going to take the time to find the value. If they don't see it immediately, they will stop using your application. The data is very strong, and there's lots of programs released every day where patients come on board and that are never seen again, and it's because they didn't find that value. There's also another idea within patient applications, and I spend a lot of time talking with my clients about this, but your app is the least cool and least fun item on their phone. So we see these phones as opportunities because everyone has them, but that doesn't mean a patient with diabetes is super excited about their diabetes application. They're excited about all the other apps on their phone. And if you can earn the right for them to participate in their diabetes app, that's great. The other then is top two segments of what we're looking at is providers. It's often thought of as docs, and I think that is very nearsighted. When we're saying providers today, we're thinking of nurses, we're thinking of care team members. You've got MAs as well as MDs providing care, and you have lots of different people that touch patients. The good news about providers is they're mobile. So, when we think of the saturation and the adoption rate of these groups, within smartphones, it's incredibly high. But they're also incredibly busy. They're burdened. And you have a, existing elephant in the room in the fact that they've been provided unhelpful software today. So when you walk in the room and you're talking with care team members about all the exciting programs you want to deliver, you should expect that they've been burned in the past. You need to help them quickly and effectively understand why your product isn't going to have some of the inferior representations of the products that have come before it. And that's a real challenge as we think of these groups. And so when we think about it, what's in it for them and how this impacts the user, again, when we think of technology and new technology specifically, there's really three goals for it. Can it save me money? Can it save me time? Can it help me do something new or better that I haven't done before? And this value has to be understood. So if you have to take the time to educate somebody on this, then you're really going to miss the boat. We don't design apps, and we've never built apps that have an information button or have to explain to somebody what it's for. If you're going to have to do that, you're going to really anticipate some significant challenges in getting started. It also goes without saying, and take a second here to think about this, that you have to have a goal. It seems obvious, but goals have to be transparent to the user. And sometimes when we say this in audiences, and we sit in a conference room, in a boardroom, and say the user has to understand the goal, we'll often get mystified looks on the people in the room. And that's just as simple as, if I'm a user I need to understand what this product is for and how I'm going to use it. And then vice versa. Whoever's providing that to me needs to understand the value I'm going to get from it. And again, often in healthcare, programs are designed and built for somebody else and not necessarily for that user in mind. And then you have downstream problems as the user isn't going to use the product or isn't going to get the value out of it because they don't understand what they're looking for. In healthcare, we don't often talk about them in goals, but we talk them in the words of outcomes. And so, again, if you're looking for the biggest bang for the buck and you're looking for a program that can get care teams excited and healthcare excited, you're talking about a program that's helping to really drive outcomes. And there's various ways. Two of the most common that we hear of on a regular basis, and our clients are talking about, I'm sure viewers are as well, is increasing patient adherence. So all the different things happening around population health and managing chronic conditions and dealing with all the things that we need to within keeping patients as a part of a program. Those are hot buttons, and if you can tie your deliveries to outcomes and you can have a clear and defined ROI that someone can see from that, you're in a much better spot. Decreasing admissions, that's another one. And so, there's a lot of effort now in keeping patients out of the hospital. And again, that follows the same model. So these are both patient-focused goals or system or focused or organizational focused goals. But there's a lot of these ideas. And so, again, it goes back to those buzzwords on that first page. Make program. You're tying your user experience and all of the things that you're going to provide into it around a very crystal clear outcome. So the user understands the ROI, the user understands the outcome, and that you're able to track and measure that. The other part of this that is a big success, and we think about applications that users are going to love and that they're going to gravitate towards in the future and they're going to help move healthcare forward, is something that isn't done today, but is something we're going to need in the future. And so, sports analogies are something everybody loves within these, but when a quarterback throws a pass, they're not throwing it where the receiver is today. That receiver's running. And don't be mistaken, healthcare is running. And so when you're looking at developing your program or delivering your piece, you're going to do exactly what a quarterback does. You're going to pass the ball on down the field and let the receiver run underneath it. So you want to be thinking about what are the next steps. And so if you're talking with your clients and you're talking with these organizations, you're internal and you're building something for your health system, you want to be thinking of where you're going, not necessarily where you are today. Where you are today might be a lot less important than where you're trying to go in the future. And along those lines, and what we really think about this, if you're looking to hit the home run, the exciting opportunities from this, I always bring up the Steve Jobs conversation. So if you're as old as I am, I was watching on the web that day that Steve Jobs introduced the iPhone. And he introduced it as something that would, replace the phone, would replace an iPod, replace a camera, all in one. And that was their triple win. And that's what they sold to people. It's humorous. We're talking today, and every time Apple talks today about apps, Steve didn't mention apps that day. And actually, they didn't even have third-party apps that day. And I think that's what we're talking about with technology, and that's what you're thinking about with your product, hopefully. There's probably some outcome, some ROI, some deliverable that you're not even familiar with yet, but you will achieve from users using the product. And that's when things go really well. And so that's the other reason why you want to throw the ball down the field and run underneath it. You want to build something out for where you're going, because where things were going were these apps. And this ability to deliver those became a really exciting opportunity. So I wanted to provide a little bit of a summary here. So as we're planning a stickier healthcare app, and stickier is the term we use. People love it. They use it on a regular basis. And so it's kind of an industry term. We didn't create it, but then we think of it as sticky, something that draws their attention on a regular basis. So there are these 4 pillars that we think of as really important. So having a clear goal, knowing the user, focusing on what's in it for the user, and then building something that's needed. So thinking about that larger value and the direction you're going in the future. If you can hit those 4 components, you're going to find yourself in a really sweet spot and a unique opportunity with where you're going. So, there's a whole other side to this. We talk with a lot of people about a plan. And so when we're talking about applications and we're putting these plans together, everybody gets excited. There's the second part of that. and it's a 50-50 proposition. That's the execution of that plan. They're completely different things. You're going to have a great plan, and hopefully you have a very good plan. You take the time to organize that information. You take the time to figure out what you're doing. You're going to interview people. You're going to have your focus groups. You're going to make sure that all the deliveries you're going to build are going to be there. When it comes time to execute, you know, that's 50% of the ballgame. And so when we really think about execution, you know, we're not going to get into all the code level conversations today. That's a different conversation for a different day. We're happy to have it, and is extremely important as a part of what you're doing. But when we think about it from a user's perspective, we really think about these 4 things to keep in mind. You know, design matters, and we encourage everybody to use designers. Have some kind of user experience. Have someone who knows how to make things fit together and look good. We always say it, and it is true, and you'll see it from your users and from everybody who's commenting on your products. You know, something shiny gets used more. It's an important part of the mobile application experience. Web designers in healthcare don't have as much prevalence around it. It's just not there as much, but it's something we have to deal with. Along those lines is using best practices. So some of this is pretty easy, right? And so if you're designing an application, benchmark from other apps that people use all the time. If it's a piece that's using location, look at Uber. If it's something that's using purchasing, look at Amazon. Look at what other companies are doing, who you're competing against, and who you're not necessarily competing against, but who that logic could flow from. We take those best practices, and you should too, and build them in. It's easier for users to understand what's going on with their applications. We've hit on this, but you also want to plan for the future. So you want to be ready for what's coming next. If you're going to sell your program internally to your organization, you'll want to be talking, even if you haven't figured out what those next pieces are, about what version 2 and 3 looks like. It is a crazy situation that we deal with apps, but this idea of evolving rapidly, growing and learning fast, is a big part of mobile that just doesn't seem to be part of other technology aspects, especially in healthcare. We have many products that will sit stagnant for 6, 8, 10 years, and mobile applications would have this expectation of expanding and evolving every couple of years. And that's an exciting opportunity, and it's certainly important as you're creating your programming. You know, when we think about executing success, right, so what are these 3, you know, we have 3 pillars. What are these things? I call them the 3 legs of the stool. All 3 legs need to be present, need to be part of what you're doing, and if each, you know, or any of those legs is not in alignment for one reason, you're going to fall off the stool and your program's going to fall. Clearly, the technology has to work. Again, there's lots and lots of aspects of technology, whether you're building native applications, whether you're using JavaScript programs that build applications, whatever that is, that technology that you select, and you should select it. You should make an active choice of which technology you're going to use. It needs to be capable of delivering those components that are important for your success. Interoperability is a critical part of this. Sometimes it's there and sometimes it's not. But if you have the opportunity to making something inoperable, you have to do it. You know, not anymore are healthcare people working in silos. And so especially if you're looking at patients and healthcare professionals, if you can deliver them an opportunity to integrate data that comes from somewhere else that helps make their experience more valuable, you're going to have a huge opportunity for success. You're going to get a lot more people excited, and you're going to have a lot more opportunity for growth into the future. You know, and the final part of that is the user experience. Every click matters. We are obscenely crazy about clicks. And so if we have a chance to get rid of one click on a page, we're going to work actively to do it. And I think every healthcare app should. What we know about users is they don't want to use the product for a long time. They want to get in and get out. If you really want to look at success in mobile technology, look at Amazon and how quickly they and how easily they have made it to pay a bill, to buy a product, and to get in and get out and get something. That's the user experience you want. That's the value you want to bring to your customers. That's what you want to think about as you're really delivering these programs. And really, again, all 3 of these legs of the stool need to be present for you to have success and to really have long-term success. The other part of this that's really just an accepted part of everything today is measurement and ROI. So you've got to have some kind of analytics program built into these things. Analytics are free today. So you can use Google Analytics or Flurry or whatever you want to use, but look at and tie each page, each experience, each click to something so that you can measure it, you can track it, you can provide your ROI. This is important for a number of different angles, but again, you've hopefully started with a goal, and now you can use this ROI to figure out what that goal is. And in healthcare, there's lots of different goals. So maybe it's looking at a readmission rate that you were able to impact and grabbing the information from that application. Maybe it's number of users you were able to add in. Maybe it's number of clicks. Whatever your goal is, you've got to tie that back. And so when we think of anything that we're doing, internal, external, I don't care what it is, there has to be some kind of analytics for it because people want their data. Every client, every situation, everyone we go into today expects a high level of data. So you've got to have that built into your program. And like I said, it's free. Take advantage of it. As we're wrapping up here, and this is the last slide, you can fail. So, the kind of idea of failure and that you can't fail if you actually learn why is a little bit of a misnomer. But I do like to make this very clear. The one mistake or the one opportunity that's not taken advantage of within a lot of organizations is really embracing learning. And so no healthcare client wants to hear about failure today, and I wouldn't encourage you to go fail. But what I would encourage you to do is roll out a program and then learn from it. And you will have areas of that program that are less successful than others. You can call them failures if you want. I'd call them the opportunity to learn. And as long as you're learning and growing, and you can look at the analytics, and you can track, and you can understand, then you can improve that product and make it better over time. What I would tell you is we've rolled out lots and lots of applications, and we've had lots of successes, and we've had lots of failures. We've been able to turn almost all of those failures into something very positive and very effective out in the future. We did it through those analytics, we did it through understanding our user, and we did it through partnering with our client. And so when you're rolling out these programs, you should prepare for everything not to go right. And that's okay. Anytime you roll out a newer program, you're going to have that environment. And you've got to go around it, and you've got to have this idea that you can change the world from what you're doing. You can change, again, it might just be a program you're rolling out internally, but changing the world is really this awesome opportunity that we think of. Again, as we started, we were thinking of technology and all these new experiences and new things we could deliver. We want you to go out and change the world, and we think the opportunity is there with mobile applications. So I'll turn this back over and back to the moderator. Do we have any questions at this time that I can answer?
Thanks, Jeff. Yeah, our first question is, what are the most successful apps?
Yeah, so this is a question that we actually hear on a regular basis. So everyone wants to know what's successful. It's all contextual. And so, again, as we started off in healthcare, there are some very successful applications for patients. There's very successful applications for physicians and care teams, for professionals, for all these different. What I would encourage you to do is make sure you understand your marketplace and the specific group of people you're serving and understand what success means. Again, if you're readmitting, if you're trying to prevent readmissions of patients within a cardiology context, you might not have to touch that many patients to have a huge dollar figure and the return on investment. So make sure you understand those. Success is an interesting word that you want to make sure you understand and that you can deliver on.
Okay, our next question, how do you prioritize the goals of an app?
That's a good question. And so this is always the toughest part. So you're going to sit down and as the team, you're going to look at all the different value points that you want to do. The first and foremost thing that I would encourage you to do is always try to keep it simple. Try to keep it focused. And so your priorities should not be 6, 8, 10 deep. They've got to be 2 or 3 deep. And so whenever we're sitting and talking about contextually what we want to do, we're trying to draw those together and to create, less priorities, quite frankly. And those priorities need to be balanced. So it's got to be a 50-50 proposition at least. And half of those priorities need to be user-based. What can we give the user to do? What can we have them do? And then half of them has to be client-based. Whoever's paying for the program, whoever's looking for the ROI, and making sure that they're getting the value around it. But again, what I would encourage you to think of is really some of the most successful applications that you're using on your phone today. They're really single service. They're very focused. You know what they're for, and you're able to utilize them on a very simple basis.
When you mentioned building out focus groups, do you have any advice on who may impact your efforts the best?
Yeah, we try to get a variety of individuals. We do lots and lots of focus groups with clients. And clearly, if it's a patient-facing program, you want some patients involved. But you don't want all patients. You need a mixture of all the people that touch those patients. And so we try to do a 360 view of that. So the physician, everybody, nurse, practitioner, other people that are going to touch that patient, and then patients as well. You might not talk to them all in the same group at the same time, but you want to get a look and get an angle from all these different people about what's happening and make sure that you have an understanding of each different person who participates in that angle. And when you've done that, you've hopefully gotten a good idea from that group of what the workflow is, what the challenges are, and what the goals they're looking for.
Can you talk a little bit about what an app would cost?
Yeah, so everybody wants to know what's the price. And it's this really, interesting concept. What I turn it around to is, what does a website cost? And when you think about a website, you think about an application, you're kind of starting to go the same route. The answer to this question is there is a wide range and there is not one price for a product. Budgets always need to be present, and especially in new programs, you need to have a good idea of what those are. They can range from, we've done programs for $15,000 that were very minimal, simple applications to millions of dollars that were really advanced, highly integrated programs that required lots and lots of people in production. So when you're thinking about cost, you want to keep a couple factors in mind. Who are all the people that need to be present? How long is it going to take for them? What are all the things we need to connect to? And what are other things that we need to do, whether it's security or other aspects of regulatory pieces? What are all those things that we need to get? And so you want to have those 4 or 5 important thought processes together so you can create a focus around it. And so not to not answer the question, but cost is different for the size and scope of each project, and it can be very simple all the way up to very complex and very integrated programs.
Okay, when forecasting the ROI for a new innovation, do you have any insight toward what resources one could use to approximate the true value?
Yeah, I think the resources are there, and so to me, this is management by walking around. I would go to all of the different people that are impacted by that product and get costs from them. It's often difficult to do, but when you think about ROI, you are really trying to get to the bottom of what are we going to gain from this advantage or this, and in many cases, those existing components are there. And so it's digging into accounting or whomever needs to give you information on what things cost. It's looking and managing with people. We've literally walked around health systems, and I do every single day, and look at workflow. There are people that actually get a time clock out there and clock the time that it takes to do something. And then look at the averages around those and use that average to do this. And so within healthcare and ROI, there's typically 2 big goals. One, you're trying to save time, or the other 2, you're trying to save money. Both are really important. I wouldn't say that there's one that's more important than the other. A lot of industries really focus on saving money. If you can save time in healthcare, or if you can do more with less people, which is the same thing as saving time, right? So if I can cut 3 people out of a process, and then I can do it faster, I've just cut out all of the costs associated with those 3 people. Those are huge advantages that are often moving the dime in a pretty big way.
All right, that was our last question. So with that, we'll conclude the webinar. I want to thank everyone for joining us today, and thank you, Jeff, for the terrific presentation. As a reminder to attendees, watch your email for links to the recording of today's webinar, as well as the PDF version of the PowerPoint presentation. We look forward to seeing you at our next HIS Talk webinar, and I hope you all enjoy the rest of your day.